I see adult patients that have headache, simply put, but the headache can be from a variety of causes. I see a lot of patients that have migraine because that's so prevalent in our population, but I also see patients that have rare headache disorders and facial pain disorders like trigeminal neuralgia. So a first visit with a patient typically starts with me getting a full headache history. So we go back to your childhood. If you had headaches as a child, as a teenager, how they changed over the years, different things that have been tried. So after we do a headache history, we'll do a neurologic exam. And then we'll talk a bit about the diagnosis, what types of testing may be needed, and treatment options. And treatment options really, I like to come to that decision together with the patient. So I'll usually present a few different options, and we'll talk about the pros and cons of each and come up with a plan together. One of the unique things here is that we always kind of look at an interdisciplinary approach. So it's not just medication is only one part of the treatment, part of that whole treatment pie. There's therapy and diet changes and sleep improvement that all also play a role. When I'm not here, I spend a lot of time with my husband outdoors. We like going for walks, we like going hiking, and then we like to go see our family and friends. We're fortunate that our parents live close by and we're able to drive and see them on weekends.